Hey there, my name is Raj, and if you've come to this video randomly, just know that this video is a part of an entire playlist which has a much more structured approach towards OCD and recovery through natural methods. So make sure you check the entire playlist for better understanding. Cheers.
OCD can kiss my ass.
All right. So we are at, can you do this with medication? And the answer is, of course, ta-da, yes. This is a very kind of thing that, a lot of people come to me and ask me, is this okay? Can you do these practices with medication? Of course, you can do that. In fact, I would suggest that, personally, there are certain people who have a very high severe level of OCD, and they have been prescribed medicines. And the last thing that I would want you to do is just experiment with some stuff. If you think, because I'll tell you my own story. I did not go the meditation route. I have just simply done these things, and they worked. Okay, but of course, everyone's made a little different, and you would be made a little different, and the third person is made a little different. It depends a lot on many factors. How old are you? Are you aged? Are you at a level where you can kind of take it and just be okay with some kind of counseling or blah blah blah, or so on and so forth. Or you, how much are you in fitness? So a lot many factors depend on these things. But if you feel that it's been a while and there you're not making any kind of progress, and it's just situation is getting tough, I strongly suggest talk to a doctor, go to them, tell them if this thing if the medicines are going to help you, because you can do this with medications, because these are natural methods. These are not going to have any kind of side effects or anything like that. It's simply breathing and standing and meditation techniques. That's about it. So keep that option as well. Never say, if I'm going to do this or that. That's not the thing. Can you do both the things? Because our objective in totality is to make sure that we get better, whatever way is there. And depending on the situation that you're in, your situation more. Okay, and the person closest to you knows it more. The doctor that you speak to knows it more. Your family members know it more. I have not met you. I have not spoken to you. So what the best advice that I can give you is that you can do both the things together, because the end objective is to get better and overcome this problem and have a lovely life. Okay, so of course what's going to happen is, generally the people who were on medications, how this helped them was that when they started the medication process, they also started these kind of processes along with it. They continued with the medication, and slowly when the doctor said, okay, the medication can come down, they come down. And when they were easing off the medication, this process that they were doing was kicking in, and that continued them and did not let them completely come down as soon as they were off medication. And once you're off the medication, as per the advice of the doctor that you're working with and who's helping you, this can actually keep you there, keep you at that level, or even keep increasing your awareness level and your mental health level while even after you are off medication. So I strongly suggest that you take the advice of the people next to you, and if you think that it is currently manageable and you can just do this, that's also fine, and the other thing is also fine. Our entire objective is just to be getting better with whatever way we can. All right, this is a natural method, that's a medication method. Both should go together, or whatever the one that you prefer. So that's for this particular video. I'll see you in the next one.